Talking health with Dr. Scott Ackerman this morning. When patients are faced with breast cancer, it is important to know that there is not a one-size-fits-all treatment. Physicians can use anything from family history to individual cells to determine an appropriate course of action. Dr. Ackerman is joining us now to talk about the types of individual treatments that are available. Good morning. Thank you for being here.
Thank you, Jen.
I think that tends to be an assumption that, particularly if I have some kind of cancer diagnosis, and I hope that certainly never happens, but that I would get an individualized treatment, but that's not necessarily always the case.
No, it's not. A lot of physicians, when we see cancer patients, we have these national guidelines regarding treatment of different kinds of cancer. And they're very well thought out and very well written guidelines. And they help us decide to decide how to treat a patient with cancer. And we have these for breast cancer as well. We have for other cancers too. And these guidelines, sometimes a lot of physicians feel constrained by that. And forget that these are just guidelines. This isn't really the Holy Grail or the law. And so what physicians need to do is to provide treatment that's individualized for the patient that are within the guidelines generally, but they could vary a bit from the guidelines. Every patient, every woman with breast cancer is different. There are different types of cancer, there are different age, different conditions that she may have in her life that will affect the way we provide cancer treatment.
It's interesting because, most people I've ever talked to who have ever been diagnosed with cancer, they typically will talk about getting a second opinion. Are there certain questions then that a patient who's just received what could be a devastating diagnosis should be asking a doctor, an oncologist, an example, before they decide to maybe go with that doctor?
Absolutely. So it's always good to get a second opinion. I think if for nothing else, peace of mind. Maybe a second opinion, a lot of people tell you it's not really worth it. The kind of cancer you have is fairly straightforward. Our treatments are well established. But that being said, it's good to hear someone else say that, if that's the case, and that way you feel better about it, because not getting that second opinion, and if you have a bad outcome or have any kind of adverse effects, you're always going to be having second thoughts about why didn't I get a second opinion. But getting a second opinion is a great idea. The questions you should ask is, what is specific about me, or what's unique about me and my body and my cancer that is making you want to make this recommendation to me for my treatment? Have you taken into consideration my other medical issues? Have you taken into consideration my family history and my genetics and those sort of things?
Are there changes, that over the years, as I'm sure we've seen with all sorts of new research, in terms of, therapeutic treatments?
Yes, there is. There's some new targeted therapies which are very cool for me. And so a lot of women with breast cancer have other morbidities, what we call comorbidities, other diseases. She may have heart disease, or she may have some lung disease, or she may have scoliosis, which makes it difficult to treat a patient properly with radiation. And she may have a pacemaker, those sort of things. So we have advances in some targeted therapies, and we've identified women who don't need necessarily as comprehensive treatment as we thought before. And maybe that comprehensive treatment with these underlying other problems could cause more harm than good. And so some of these target therapies we have found to be equivalent with outcome. Maybe in radiation, we have something called AccuBoost, for instance, where we just treat that one small area in the breast and not the whole breast. It may not be for every woman, but if a woman has some other underlying problems, this will be very good, and it won't cause any side effects or any problems later on. So these neat kind of targeted therapies are very advantageous for women.
And another example of why it's so important that you engage your doctor, and ask a lot of questions. Dr. Ackerman, thank you for being here. I do appreciate it. And of course, if you missed any of this interview, don't worry, we will post it later this morning on our website, news4jax.com. Just look under the health section.